This episode is brought to you by Progressive Insurance. You chose to hit play on this podcast today. Smart choice. Make another smart choice with Auto Quote Explorer to compare rates from multiple car insurance companies all at once. Try it at progressive.com. Progressive Casualty Insurance Company and Affiliates. Not available in all states or situations. Prices vary based on how you buy.
Welcome to Season 8 of Flusterclux with Lynn Lyons, where we talk about managing worry, anxiety, and all the other emotions too.
I'm Lynn Lyons. I'm an anxiety expert, author, speaker, and mom. I've been a therapist for 35 years, and I'm still in the trenches with families, helping them navigate daily struggles and big problems. Parenting can be a flusterclux, but we tackle the serious stuff without being too serious.
I'm Robin. I'm Lynn's sister-in-law and co-host, and I'm here to ask your questions.
And I'm Ed, the producer of Flusterclux.
And my brother.
And my husband.
Anxiety is a family problem with a family solution. Hi, everybody. Welcome. I do not have Robin or Ed with me today, but I do have somebody equally special. We have a guest on the podcast today, Ali Navidi. He is a therapist who specializes in GI disorders, so gastrointestinal disorders. So Ali, thank you so much for coming on the podcast. I became aware of you because I was listening to another one of my friends' podcasts, Jessica Hochman. I've been on her podcast a few times. We've become buddies. And she had you on, and I was listening, and she mentioned me to you.
Yes.
And then I was like, hey, I should know. And then you reached out to me, and I said to Jessica, I should have that guy on my podcast. And so in this small little podcast world where we all just hang out with headphones and microphones, you and I have been united in our quest.
It is kismet.
It is kismet. Yeah. So will you tell everybody about you? What you do, where you are, how you got into this racket?
Sure. So I am a clinical psychologist. I'm in the DC metro area. And then I have been interested in clinical hypnosis before I was a psychologist. So that's probably what got me to change. You know, I was a microbiology major. I was working in biotech, and I was about to start biochemistry PhD.
Woohoo.
No, but luckily, but I was spending all my time reading about hypnosis, reading about psychology, reading about clinical treatment. And I was kind of a junior therapist, you know, to everyone around me. So luckily my wife was like, hey, you might want to consider doing something you're really passionate for. That was the light bulb. And I just shifted over and got into a graduate program, and long story short, had my own practice. And I've had that practice for at least 14 years. And the funny thing was, I didn't get into it with a plan. I knew I loved hypnosis as a tool. I love CBT. And I just wanted to just see everybody who'd walk in the door, kids, adults, whatever. But slowly, I discovered what a great tool it was, hypnosis, for mind-body problems.
Yeah. The somatic symptoms that we see.
Yes. And I had success with them. So then what does success breed? It breeds more people coming and more doctors finding out. And there's a real lack of availability for people in my area. And it turns out pretty much every area who will see kids, are trained in hypnosis, and understand GI. Those three things, there's pretty much nobody on an outpatient basis in my area that did that. About 5 years ago, out of frustration, because there's nobody to refer to when I'm full, I started a bigger practice called GI psychology. And it's been really good and, in a way, unfortunately successful, meaning I don't have as much time to see the patients.
Oh, because you're running the practice.
Because I'm running the practice. Exactly. Yeah.
Okay. So you create this practice called GI psychology, and what you discover, which is not a surprise to me at all because I specialize in anxiety, is that there are an enormous amount of people, including little people, who have GI problems that are directly related to their anxiety, to their worry, and that they are being treated symptomatically. So they are getting medications, they're getting endoscopies, they're getting Tums, they're getting Prilosec. And you and I know that there is an enormous amount of really cool research about how these GI problems can really be helped by behavioral methods, by clinical hypnosis, which is what you and I have in common also. And some really incredible work can be done that can solve these problems. And your frustration is probably similar to my frustration, is how few people really know about this.
Yes. How few people know and how few are trained.
Yeah, both.
Right. So even if someone out there, a parent, understands all this and knows, okay, my anxious kid who's having chronic nausea, I need to get them this very specific kind of help, they would have a very hard time finding it. And that's why I started the bigger practice, because I wanted to improve access to treatment. So that's what we did. We were in all 50 states. I'm in charge of the training of all the clinicians, and I make sure that they are thoroughly trained. So we have like a 9-month training program.
Wow.
Yes.
How many clinicians do you have in your practice?
We have 17 clinicians at this point. Yeah.
And are you doing everything remotely?
Yep. All telehealth.
All telehealth. Okay. Which some people think, how do you do it by telehealth? But you can do a lot of stuff by telehealth. How do you know when you're hiring people? Because I work by myself. I have the only employee I have, which he resents me saying this, is my husband. And my son edits my ads on the podcast, and I pay him too. But how do you know what you're looking for? When you're looking for somebody who's going to come into this practice, what are you looking for?
Yeah, we tend to look for people who have some health psych background, meaning maybe they've been embedded in a primary care. Maybe they've worked in hospital. We want people who are comfortable working with patients with medical conditions, often complex medical conditions, with an overlay of mental health, potentially trauma. So these are complex patients. And so we want that background. And then just in terms of what works for our culture, we figured out over time what we're really looking for. We're looking for very conscientious people who are very generous interpersonally and love to learn.
Curiosity.
Yeah, never want to stop learning. So like those 3 things are what we're looking for when we're hiring. Yeah.
Okay, so everybody, I have a listener question that we got, and I'm going to read it to Ali, and he's going to answer it, because I gave him a little preview before he started, and he's like, oh my gosh, that's what I do all day long. The interesting thing that I found out through this research of a colleague of mine, great guy named Scott Miller, and he's always trying to figure out what makes a good therapist. And one of the things that his research showed is that it's about curiosity and what the therapist does for their own learning, their own curiosity outside of the therapy sessions. So the more that people are reading, going to interesting trainings, listening to podcasts, sort of expanding their knowledge, those are what he refers to as the master therapists. And so it's interesting that that's the quality that you're really keying into when you're hiring. You want somebody who wants to learn and be curious and that kind of stuff. So say you've got, you're treating a kid. Give me the typical client that seeks you out.
Yeah. So this would be, if you're talking kids, you're thinking of an anxious kid, often kind of a bit type A if you're looking at the older ones, kind of high achieving, often female. They might have functional abdominal pain. They might have IBS.
Functional abdominal pain is when your digestive system everything is functional. That's why it's called functional abdominal pain. They can find nothing wrong with the way your system works, but you still have pain, everybody. That's functional abdominal pain. About 13% of kids will experience functional abdominal pain in the course of their life. IBS is irritable bowel syndrome. We all know that because we watch TV and we see the ads. Okay, go ahead.
Very, very frequently, we will find what I call like a GI trauma in their history. And I think that kind of sets the stage. And you could almost think of it as it creates a place that will hold their anxiety. So what I mean by that is they might have had food poisoning. They might have had C. diff, which is, I forget what it stands for, but it's a real nasty one. It makes them have a lot of diarrhea.
It's like a bacterial infection. I forget what it stands for too, but yeah, but it's bad. Even like the norovirus, right? They could have gotten a stomach bug where they're just like puking their brains out. Yeah. Okay.
Yeah. I had one patient, I think it was just food poisoning. 10-year-old woke up vomiting. You're just waking up, you're confused, you're not sure where you are, what's happening, you're vomiting. It's scary.
Yes.
And so that imprinted on her. And afterwards, she developed a metaphobia, fear of vomiting. And very frequently, you see with a metaphobia, you see functional abdominal pain because you've got that really intense hypervigilance with catastrophic thinking.
Yeah. And they're just assessing their GI system all the time. And they're catastrophically assessing it. So if they hear a little gurgle, right, or they have a little
emergency.
Yeah, they have a little burp, or maybe they have a little fart or something, that this is the first sign toward another catastrophic vomiting episode. So they become very hypervigilant, and then their world gets smaller and smaller. Yeah. And so they come in and they give you the history, and within 3.5 minutes, you know exactly what you're going to do, because it's not really all that unique, right? So you don't have to spend 4 sessions doing an assessment.
No.
We hear that a lot, though. Yeah. You don't know about the 4-session assessment model?
4 sessions? Good Lord. The treatment is done in 4 sessions usually.
Yeah. So you know what you're going to do. And then give us like a little, so say you've got this kid who's come in and they had one of those, like this 10-year-old you're talking about, woke up food poisoning. So then what are you going to do right away? What are the first things that you're going to do?
After I've assessed and made sure there isn't anything else I need to be aware of, I would then try to adapt some form of psychoeducation to their understanding. And I also want to know from the parents what kind of workup they've had. Because if they've had a very thorough workup in my psychoeducation, because I want to teach them about the mind and body and about the mind and gut. And if they've had a nice thorough workup, I want to really emphasize to them how safe they are. Their stomach is healthy, it's strong, because even just doing that goes a long way. That psychoed is already an intervention.
Right. Yeah. Psychoeducation, giving people accurate information about what's going on, is enormously powerful. It's the same thing that happens where I go through the worry cycle. Most people have never been taught how this thing works. They don't even know what the physical symptoms are, how they relate to the fight or flight system, right? So people don't know why their heart is pounding. They don't know why they can't think straight. They don't know why when they hyperventilate, they feel dizzy. So you give them that. And so you're basically normalizing. You're saying, this is how it works. And we don't want to say, we know there's nothing wrong. So you want to say, we know your stomach is strong and functioning.
Yes.
It knows what to do. Yep. And something has gone awry. Something has gotten a little screwed up. And then your job is to help get your GI system back to where it needs to be.
Yeah. I usually like to talk about how the way that your brain is talking to your belly has gotten messed up and they're not getting along. And we need to teach them how to get along better.
Oh, I love that language. Yeah. We need to teach them how to get along better. All right. We're going to take a quick break. And when we come back, I'm going to read the question and Ali's going to go through and tell us what he would do to help this mom. It's a 7-year-old girl. I'm sure, Ali, it's a very typical scenario for you. So we'll be right back. All right. It's the time of year. We've got sensory overload everywhere, but one feeling we're still chasing, it's cozy. And Bombas has the socks, the slippers, the tees, basically everything you need to be as cozy as possible. Bombas makes socks that I wear every day. In fact, I'm looking down at my feet. I'm wearing them right now. Every time I go to the gym, I've got on my Bombas socks. I use them for hiking, for walking, for lifting weights. And you know what else? I bought this Bombas bra. Who knew? It's fabulous. It is comfortable. The fit is amazing. Bombas makes gift giving easy. So, what do you get your son's girlfriend? What do you get your friend that you work out with every day? What do you get your father-in-law who's really picky about whether or not his socks feel itchy? Bombas is the place to go. And we haven't even gotten to the best part. For every pair of Bombas you purchase, Bombas donates one to someone facing homelessness on your behalf. So anytime you get something cozy, someone else does too. Head over to bombas.com/audio and use code AUDIO for 20% off your first purchase. That's BOMBAS.com/audio, code AUDIO at checkout. I love learning new things. I love hearing stories about how people succeed at what they do. Even if their area of expertise is not at all related to mine, you pick up the patterns, the processes, what they do that actually makes them better at their chosen field. With Masterclass, learn from the best to become your best. Listening to James Clear talk about Atomic Habits, a book that so many of my clients have read in order to be more productive. There is a parenting class with one of my favorites, Lisa D'Amour, and other wonderful experts, Alice Waters, Gordon Ramsay. Anything that you can imagine is on Masterclass. I can watch it on my phone. I can take these classes with me, and they're just stimulating and so interesting. They've got plans starting at $10 a month, billed annually. You get unlimited access to over 200 classes taught by the world's best business leaders, writers, chefs, and more. You can gift Masterclass. Here we are, the time of holiday giving. What a great gift to give someone so that they can enjoy all of this amazing information. Masterclass always has great offers during the holidays, sometimes up to as much as 50% off. Head over to masterclass.com/fluster for the current offer. That's up to 50% off masterclass.com/fluster. Masterclass.com/fluster. Oh boy, those holidays are upon us, aren't they? And now's the time when we're scrambling to get the things that we need, the gifts maybe that we forgot, or the little items that you need in order to host your holiday gathering. And that's what Wayfair does for us. The holidays are here, and you can get what you need fast with Wayfair. I had to order 2 new throw pillows. I have white couches, so I got these pillows that really pop. The color is fantastic. I also needed to get a few things for my holiday table. I needed a new tablecloth. I needed a few centerpieces. Wayfair is fast and convenient. It has everything your home needs this season. It's got a huge selection of home items in every style, so it makes it easy to find gifts for everyone on your list and to fit in your personal style for your home. There is something for every style and every home, no matter your space, your budget. Wayfair makes it easy to tackle your home goals and your gift list. It's fast with easy delivery. Find all your must-haves from furniture, decor, even appliances and cookware, all in one convenient place. Get last-minute hosting essentials, gifts for all your loved ones, and decor to celebrate the holidays for way less. Head to wayfair.com right now to shop all things home. That's WAYFAIR.com. Wayfair, every style, every home. Okay, we're back. How do you tackle school avoidance when your kid wakes up in the morning with physical symptoms, GI distress and/or vomiting? When they're stuck in the bathroom, what is the script? For context, I've listened to and read all of your content. My 7-year-old has generalized anxiety. We've externalized the worry, named it Coco, talked to it, expect it to show up, etc. But Coco's getting stronger, and now she often wakes up with GI distress on school days. It's so hard to rush her to school when she's stuck in the bathroom with GI distress and vomiting. Sometimes we power through, but she still ends up at the school nurse, oftentimes vomiting in her office. She's always fine once she's home, so it's not a stomach bug. I don't want to encourage school avoidance, but those physical symptoms are real. Any advice?
Here we go. First off, as I mentioned before, we need a good workup. We need to make sure that we're not dealing with anything structural. My assumption is that, her kid has gone to the pediatrician. Pediatricians ruled out anything nasty and said, hey, I think it's maybe stress, or maybe she's saying anxiety.
And she already has. They said she already has generalized anxiety. So we know we've got an anxious kid.
Yeah. Then, I want to assess and get a bigger picture. But let's say we're going right to it. We're going to do that psychoed. We're going to explain things to the child. But also, I want to kind of assess the mom too, maybe the parents, because I want to see what level of accommodation is happening. I don't know the best word for it, but being in a way over empathetic, over indulgent.
Are they interviewing for pain?
Yeah. Oh, how are you doing today, sweetie?
How did it go?
Is your tummy okay? Oh my gosh. And their anxiety and their questions are going to elicit the wrong response. So I want to understand that. And if that's a little off, then I want to do a little coaching to talk about, okay, here's how we handle this. But let's say we're going to talk with the kid. One of the first things I like to do is teach them about hypnotic talent. Now, this is a 7-year-old. The way I work with a 7-year-old is very different than how I might work with even a 9-year-old or a 10-year-old. 7-year-old is going to be a lot more imagination, a lot more. It's not going to look so much like hypnosis as people kind of think. Their eyes might be.
Right. More informal, more conversational, more let me pull you into this story. Let's imagine this. Yeah. They don't sit back and keep their eyes closed.
So that reminds me of she might have been 7. She came in with a lot of functional abdominal pain and she really liked fairies. So we just using imagination, we created these fairies and we had her draw them. And then the fairies would come in and they were kind of battling against these evil forces in her belly and they would use their magic wands and it was great. And it took one session for her to start feeling better. And then a couple days, like a couple sessions later, because I was following up with her, she came back and said, it started hurting again. And I said, well, it sounds like you need more fairies. And so then we imagined a whole bunch more fairies and she was fine. So it can be very informal, very imaginative, and very quick with someone that's 7 years old.
Yep. Okay. So you listen to what she's interested in. So this little girl you were treating was interested in fairies. You might have a little girl who's interested in horses or might be interested in Taylor Swift or whatever. So that's called utilization. Because utilization is an Ericksonian hypnosis technique. We're really sort of getting down in the weeds here, but it's using what the person gives you, using what the child gives you, the adult gives you to create something that's meaningful. So that's like one of the top things that we learn when we're doing pediatric hypnosis, but hypnosis with anybody. What would you instruct this mom? So she's having a hard time. Her poor little girl is vomiting in the morning. She gets her into school. She goes to the school nurse. The school nurse is very empathic. The little girl comes home from school and gets better, of course. So what would you advise the mom to do in terms of managing those difficult mornings?
It sounds like she's been really educating herself a lot on anxiety and working with generalized anxiety. And I think she's doing the right things there. I think what's happened, though, is imagine you're playing a game of chess against the problem. The board has shifted. How has the board shifted? That anxiety has now, instead of being so generalized, she still has generalized anxiety, but there's also, imagine there's another piece now that's a very focused anxiety. And it's focused on all those GI symptoms because that little girl doesn't want to vomit, doesn't want this pain, and especially doesn't want it when she's not feeling safe. So that's why it doesn't happen at home, because it requires that cycle to get ramped up. The little girl starts anticipating the problem and then scanning her gut in an anxious way. She feels something and then freaks out, sends more anxiety and stress down in through the gut-brain axis, and then that creates more symptoms. And it's kind of like, as we kind of understand it, the way a panic attack cycle works. Feeds on itself.
Right. What you resist persists. So the more symptoms she feels, the more she worries about it, the more she focuses on it. What you focus on, you amplify. And then her increased worry, her increased attention to it causes the symptom that she fears. And so the pattern gets reinforced over and over and over again. Yeah. So I would say, if this were my client, I would say to the school nurse, it's okay if she stays at school and she vomits.
Oh, yeah.
Yeah.
100%.
Because this is the thing that happens sometimes is that when a child is having these GI symptoms, then the protocol is, well, if she throws up at school, she has to go home. That gets reinforced. She starts associating the vomiting with being in school. It's not happening at home. It's happening at school. So she's got to stay in school.
I would want to add a little flair to that one. So what we could do also is in the session, begin to teach the child how to do some really simple interoceptive exposure. If we can get her to feel any of those, and usually kids are very responsive. So you can have them imagine that they're feeling nauseous and uncomfortable, and they actually will, just using hypnosis. So we want to elicit a little of the symptoms and then use self-hypnosis to let her feel safe. So maybe we give her a special fairy shield so that she can just observe the feelings from a safe place. And then we can teach mom how to facilitate that. And we can even, if we want to get really fancy, try to just have the school nurse tell the kid to do something. Use your fairy shield right now, something like that.
Give the school nurse a little script. Give the school nurse a few cues. Yeah. So for people who have listened to this podcast a long time, they are listening right now and they're like, oh, here it comes. I don't like the word safe.
Oh, okay. Okay.
Well, and the reason I don't like the word safe is because when I specialize in anxiety, and there's all this talk about being safe, and I need to be safe, and I need to feel emotionally safe, and I need to be physically safe, and we need to be in a safe place. And the way that I deal with anxiety is there is an overestimation of the problem. So anxiety very often promotes things to an emergency that are not an emergency. And safe is one of those words that anxiety plays right into.
It's interesting. So the way probably a lot of people define it, I don't particularly like, because safe place involves adapting the environment, accommodating the anxiety, which is the exact wrong thing to do. But I'm talking about an internal sense of safety that people can call on. It's like a resource state.
Okay. An internal sense, because you've already done that psychoeducation, that your tummy is working just fine.
Yes.
And your body inside of you, everything is okay in there. That's what the message that you're giving.
And we don't have to keep you safe at home in order for you to feel safe, because you're going to carry that safety wherever you go.
Okay. All right. Good. I like that. You can carry that safety, that internal safety wherever you go. Yeah. Because a lot of what I hear and the language I hear is that I can't be in a place where I don't feel safe. And that's exactly how people who are anxious make their world smaller.
Yes.
Yeah. And so I wouldn't want this little girl to be told, you feel safe at home. Home is your safe place. Nope. It's an internal sense of I'm strong, I'm capable, everything's working, and I can carry that with me.
Yeah.
All right. Okay, good. I like that language. Yeah. The word safe is overused.
Oh my gosh. Yeah. And I think good meaning people are doing a lot of harm by trying to make things externally safe.
Yes.
For their children and for themselves, because they don't understand the way anxiety works.
Yeah, it's interesting. I just was out in Phoenix. I just got home the other day. It's the Western Association of Independent Camps. They were having me do a keynote, which was fun. What a fun group of people. But these are people who run summer camps out west. And they are so on the same page as us because they're all about having kids step into things. Right. They're all about building autonomy. Yeah. And the keynote note that I gave, which is just sort of a little window into my current state of mind, was basically Hold the Line was the name of the keynote. And I said, don't fall for all the ridiculous nonsense that the mental health field is trying to inject into summer camp. Hold the line. Do not buy into the nonsense. Let kids take risks. Let them be independent. Let them handle things on their own. Let them feel uncomfortable. Let them do things that are hard. Yeah, it was really like one of the most fun keynotes for me to give because it was basically like me being able to rant about the mental health field for an hour and a half.
I love it. I love it.
Yeah, it was good. So we're going to take another quick break, Ali. And when we come back, I want you to just give the top tips that you have for parents who are dealing with kids that have tummy aches or maybe some other somatic symptoms. I want a few of your do's and don'ts. All right? All right, we'll be right back. Here's the thing about being a great gift giver. When you find something truly perfect for everyone on your list, you almost don't want to give it away. That's what happened with my Quince order. I ordered some long sleeve merino wool tops. I love to be outdoors. Their activewear is amazingly versatile and comfortable and fits great. I didn't want to give it away. Well, I did give it away, but then I ordered one for myself too. Everything is so soft and well made. Quince pretty much has your whole list covered. They've got cashmere sweaters for $50. They have the kind of denim that goes with everything, silk tops and skirts for when you need to look put together. The Italian wool coats are absolutely amazing. They look designer, feel luxurious. They're made with premium materials. By working directly with trusted factories that maintain high standards for both craftsmanship and ethical practice, and by cutting out the middlemen and the markups, Quince is able to pass those savings straight to you. Find gifts so good you'll want to keep them with Quince. Go to quince.com/fluster for free shipping on your order and 365-day returns. Now available in Canada too. That's QUINCE.com/fluster to get free shipping and 365-day returns. Quince.com/fluster. 'Tis the season. We're spending money. You're going shopping. You're buying gifts. Have you ever had the experience where you open your credit card bill or you look at your bank statement and you think, where the heck did the money go? If you want to keep your finances under control this holiday season, you need to be using Monarch. Rated Wall Street Journal's best budgeting app of 2025, Monarch is the all-in-one personal finance tool that brings your entire financial life together in one clean interface on your laptop or your phone. And right now, just for our listeners, Monarch is offering 50% off your first year. What happens when you start to track your spending? What happens when you start paying attention to the places that your money goes? It gives you the ability to check in to make sure that you are meeting your financial goals. You may have a goal of saving $100 a week or reducing your spending $1,000 a month. It doesn't matter, but what happens is that you begin to pay attention. You become an expert in your own budgeting. It helps with your relationships. It helps with the things you want to spend your money on, those big trips you might be planning or those major purchases you want to make. Don't let financial opportunities slip through the cracks. Use code FLUSTER at monarch.com in your browser for half off your first year. That's 50% off your first year at monarch.com with code FLUSTER.
Hey everybody, it's Ophira Eisenberg from the Parenting is a Joke podcast. Let me ask you a question. Are you multitasking right now? Oh yeah, commuting, working out, school drop-off or pickup, crossing things off on your never-ending to-do list. But what about checking in on you? Therapy can help make that part easier. Whether it's your first time in therapy or your 50th, Grow Therapy makes it simple. They connect you with thousands of independent licensed therapists across the U.S., offering both virtual and in-person sessions, nights and weekends. You can get started in as little as 2 days, and if something comes up, you can cancel up to 24 hours in advance at no cost. There are no subscriptions, no long-term commitments, just therapy on your time. So whatever challenges you're facing, Grow Therapy is here to help. Sessions average about $21 with insurance, and some pay as little as $0 depending on their plan. Visit growtherapy.com/parents today to get started. That's growtherapy.com/parents. One more time, growtherapy.com/parents. Availability and coverage vary by state and insurance plan.
Okay, so now back to the show. All right, Ali, so parents are listening to this and they've got a child who's a tummy acher, and that's probably one of the most common reasons why kids don't go to school. Anxious kids don't go to school because of tummy aches. They're missing activities. They're not engaging in things. if a child has functional abdominal pain, if they have chronic tummy aches, if they've got emetophobia, what's the number one piece of advice that you would give parents as they're trying to figure this out?
So this would usually come with a lot of context, but basically is they need to go to school.
Mm-hmm.
You can't let them stay home. Too often I've seen these poor children who have been allowed to stay home, and it just starts creating secondary problems. Very soon after that, they're going to become anxious about being in school. It's going to be harder and harder to get them out. They're going to develop, social issues. They're going to feel like they're separate from, it's just a terrible situation. The longer it goes, the worse it gets. Please don't let them stay home. And a frequent explanation I give is, look, if you had a kid with just a regular stomach ache, keep them home. Or if some new symptom shows up, but we know exactly what this is. We know they're not in danger. We know, I'm going to use that word.
Mm-hmm.
We know their stomach is healthy and strong and safe.
Mm-hmm. Mm-hmm.
And because of that, if you keep them home, you're literally making the problem worse. And whatever we can do to figure out to get them back to school, we can kind of scale it slowly, whatever's going to work, but we need to get them back. And if they're already going to school, we need to keep them in school.
So you need to communicate with the school. You need to talk to the school nurse or whoever is dealing with the school counselor, so everybody's on the same page. Yeah, we know with school avoidance, the rule of thumb, we want them in the building as soon as possible and for as long as possible. And we've both seen situations where you've got a child with some sort of physical symptom that we know is anxiety related, and they become a patient and they get taken from doctor to doctor. They get taken to all sorts of people who, again, mean well. And now they're getting tested for food allergies. And now they're on a regimen to get rid of heavy metal toxins. And now
they go to the functional medicine. And then they start identifying with all that, like, oh, I'm sensitive. I have all these allergies. I really can't, I can't tolerate that.
I'm delicate. I'm fragile. I'm sick. That's the message. That's what gets reinforced. So we want to interrupt that. Absolutely. Okay. Anything else that, as parents are listening to this, we know that it's hard to find people who specialize in this. But one of the things that I've been saying over and over and over again is seek out specialized treatment. I see this with OCD all the time. There are kids that are screaming OCD and they're going to somebody who doesn't know how to treat OCD. And I say all the time, you wouldn't go to your dentist to have him deal with your bunion, right? You wouldn't be like, well, you sort of know how to deal with things that stick out. So can you just take this off? Get specialized treatment. Are there any other resources that you are aware of that people can look at and learn about? Do you have a website? Do you have other things that parents can learn about this so that maybe they can start addressing it right away on their own?
Yeah. So the website is gipsychology.com.
gipsychology.com. Yep. We'll put it in the show notes.
We've got a lot of resources on the site, and we have a free phone consultation where you can ask questions. Most of the people who do those are clinically trained also, so they can ask the deeper questions. And I completely agree with what you're talking about, because too often in my career, I've seen, and what I call it is these kids bounce around the medical system. They bounce around, they pick up diagnoses, they pick up the idea that they're sick, they're weak, and that they need to be careful. They need to be too careful. And by the time they've come to me, they've just suffered so much and they've missed out so much. And that's the other thing. Treatment doesn't usually take very long.
People say, well, I don't want to go to therapy and talk about what. No. This is really concrete. This is really solution focused. I talk about hypnosis as the tray on which I serve the hors d'oeuvre. It's just an amazing tool. It is used in some of the most prestigious medical institutions in this country. They have departments that are dealing with kids with issues like this, with chronic pain syndromes. It is really an amazing tool to have. And there are a lot of people who are really good at doing clinical hypnosis with kids. They can just be hard to find, but seek out expertise. Yeah, seek out expertise.
And there's at this point over 40 years of research. And I'm referencing clinical hypnosis for GI problems.
Yep.
There's this tremendous body of research.
Yeah, tremendous body. Yep. It is so effective. It's effective for pain. It's so effective for GI issues. For me, it is a fun thing to treat. Vomiting and diarrhea aren't usually all that fun to treat, but it's a fun thing to treat because we do see progress and we do see kids getting better and we see them get their lives back.
I think maybe I've mentioned this to you before, but one of the things I've always loved about doing this kind of work is, a kid comes in with functional abdominal pain and generalized anxiety. You treat the functional abdominal pain pretty quickly, but then you have this tremendous rapport and therapeutic momentum. And it's so much easier then to treat that generalized anxiety than it would have been just starting from scratch. And I really enjoy that.
Yeah, me too. And the other thing too is that I want parents to hear this. I mean, I love that when I said the 4-session assessment, you were like, what are you talking about? We really can go right at this thing. Our field can take so long, this whole sort of like, I'm building rapport for 6 months. And I say this all the time, the thing that really builds rapport is when you help somebody.
Yeah,
right. right.
Wow,
right.
that actually helped me. I feel so much better.
Yeah,
and now,
I love you.
Yeah, you're the best. I love it.
All right. Thank you for joining me, Ali. It's so nice. I so appreciate making another colleague friend who does this kind of work and who's good at what they do. We need good people in the field. So thank you for joining me. Check out gipsychology.com, everybody, and go after this thing. Don't fall for the hype. Get them into school. Get them into school. The most effective treatment for functional abdominal pain is to make your kids live their life because that's what we all want for them anyway, right?
I love it. Thank you.
Thanks for listening. And if you found this podcast helpful, please give us a 5-star review on Apple Podcasts. It helps other people find this information.
And if you'd like to dig deeper on any of these topics, we have specialized playlists on our Spotify profile, and the link is in the show notes. Topics like teens, depression, and OCD. Bye, Lynn.
Bye, Robin.
Doug. Here we have the Limu Emu in its natural habitat, helping people customize their car insurance and save hundreds with Liberty Mutual. Fascinating. It's accompanied by his natural ally, Doug.
Limu? Is that guy with the binoculars watching us?
Cut the camera. They see us.
Only pay for what you need at libertymutual.com.
Liberty, 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 liberty.
Savings vary. Underwritten by Liberty Mutual Insurance Company and affiliates. Excludes Massachusetts.